9th annual Becoming Baby Friendly in Oklahoma Summit. I'm Becky Mannel, and I'm director of our Oklahoma Breastfeeding Resource Center and a clinical assistant professor and lactation consultant here at the Health Sciences Center. And we are excited to be here, at least on Zoom in real time, and see some faces and hear some voices and hear what's going on with everyone. And as I do the state of the state to kind of kick off our summit every year, I always kind of think, okay, what's a different theme or focus that I want to have? Last year, it was a new decade. This year, I mean, what else could I say but unprecedented, right? when we look back at what's happened over the past year. So that will be my theme, kind of starting this off. But of course, our official disclosure slide. You have to attend the entire program and complete the evaluation form. Sarah sent out a lot of great information, and there will be an online evaluation to complete at the end, but it is approved for nursing education hours from the Oklahoma Nursing Association. So we're very pleased to have their support to offer that. And otherwise, I have no financial disclosures. I do also serve as executive of the nonprofit Oklahoma Mother's Milk Bank, and I'm currently president of the board of the Human Milk Banking Association of North America. So you'll hear a little bit about milk banking, and then of course we've got some great speakers lined up later. But a big thank you to the State Department of Health for funding this summit every year with Title V federal maternal child health funds. So we couldn't do this without that support. So, okay, unprecedented. Are we tired, sick and tired of hearing that word? Can we think of something else? So I thought, let's pick something off of here. So you have I'm not quite sure about some of these words on here. Like maybe I shouldn't say effed up, but we probably have felt that way. So I thought this was quite an interesting compilation. All the way from formal to very casual. So anyway, so take your pick of some different words that you might use to describe some of the things that have been happening. And then, who would have thought of going, to the grocery store, and for how many weeks could we not get toilet paper and paper towels and things like that? And to the point that my son-in-law, who is Air Force Reserve at Tinker, is offering to go to the base to get toilet paper for his parents-in-law. So, I mean, how crazy is that? But in trying to just look up some other words instead of unprecedented, surreal. Yes, we've had some really surreal things, maybe perturbing events, nonplussed and forlorn. Have we probably had some moments where we really felt forlorn, missing being able to see family and friends and coworkers and so forth? But my favorite one, and I was really excited to see this on this list, is discombobulated. So there's a good word to teach your kids if you've got children that want to learn a really cool new word. That's one of my favorite words, is discombobulated. That just explains a whole lot of events and feelings. So, of course, this time last year, we could go to a Thunder game, and we could be, out and about with thousands of people. That's me able to take my grandson Alan, to a Thunder game. Well, the Thunder is still playing, only there's nobody in the arenas. I mean, I cannot imagine, being that's your job. And of course, we're all having to work from home and maybe not see colleagues if depending on what your job is. And so same for the basketball players, there's nobody there to cheer them on. It's just not quite the same, is it? And so as this pandemic has continued, at least here at the OU Health Sciences Center, they've been really good about, they send out this well, for a while it was daily, and kind of at different stages of the pandemic, it was daily or 3 times a week or something like that. But they always had a dashboard in there. So they were closely tracking how many COVID positive patients were in the hospital. And so this is just a clip out of one of the reports where you could see we hit a peak for the OU Medical Center, the OU Health System. And that's the Oklahoma City campus. The green there is patients in the Children's Hospital, which would include our women's services. And then the orange is a smaller number that would be at the OU Health Edmond location. But you can see we hit a peak of 145 positive patients in one day that were in the hospital with COVID. So that's just been amazing. Now, the exciting piece, or the other piece of that, when we were kind of hitting those peaks, they would also report how many patients were on ventilators. And there was one day where they had 45 patients on ventilators that were COVID positive. But also they tracked, you know, how many days of PPE they had on hand. And there were numerous times that this report would come out and the number would be 2. So imagine trying to manage 145 patients, you know, 40 patients on ventilators, and you're just looking every day at how many more PPE gowns and so forth do we have. So, you know, kudos to everyone. I'm sure many in this group that, you know, have been in the hospital setting and dealing with the stress of this. The good news is our numbers now are trending way back down. But the interesting thing is, over the summer and watching these reports, when we started kind of creeping up a bit in September, and I remember thinking, oh my gosh, we've gone to 45 patients in the hospital. Oh my God, this is horrible. Little did we know how much worse it would get. So, so we're excited to see these numbers falling back down. Now, of course, we also know that the pandemic impacted breastfeeding. Sadly, you know, before we really had enough data and evidence to guide, and we had conflicting recommendations on breastfeeding from different organizations, and this was some data that the CDC collected from hospitals. This was 1,300 hospitals that reported over the summer, and you can see that in some hospitals, if it was a known or suspected positive mother, that let me hold on just a second. I realize this is moving out of the way. There we go. You know, we had hospitals that not only maybe discouraged skin to skin and rooming in or direct breastfeeding, but actually prohibited it. So, you know, how many families, yeah, had that huge disruption, and we all know how hard it is to try to initiate breastfeeding several days later when you can finally, you know, be with your baby. We also saw that hospitals, you know, decreased lactation staffing. We know many hospitals in Oklahoma that furloughed LCs, you know, non-essential healthcare workers, right? How much do we disagree with that? How many patients did they discharge maybe earlier than they normally would have? And of course, a number of hospitals, you know, many that had to eliminate their outpatient lactation consults. Maybe they were able to do virtual or telehealth, and maybe they didn't have, you know, the capacity to do that. So definitely we saw some decrease in both in hospital and out of hospital support for breastfeeding. So now, how many of you maybe, whoops, I can't get my mouse to work too good. How many of you got a pandemic puppy? We did. We weren't planning to, but our previous dog died unexpectedly, and there we were with no travel plans for the foreseeable future. So let's get a new puppy. She's now actually 75 pounds, so that she's changed a little bit since that picture. And then another unprecedented. I mean, who ever heard of doing a virtual marathon? And sadly, last year was the 20th anniversary of the Oklahoma City Memorial Marathon, and so that was done virtually. Fortunately, you know, my husband and I were able to run it together, but that was definitely a forlorn feeling to do that as well. So now, as we look at other events that have happened over the past year, and here we are in February, which is celebrating Black History Month. Last year, of course, we had the Black Lives Matter protest marches, racial justice marches, and so I've just captured a few pictures here from some of the Tulsa marches, because they actually planned and held, you know, a really large Black Lives Matter protest march on the 99th anniversary of the Tulsa Race Massacre. Of course, you know, they've been doing a lot of work to have some commemoration of the 100th anniversary, which will be this year. So you know, things to keep that on your radar, of course. But you know, it's pretty Gosh, what's another feeling that's on that list? Definitely unsettling to just, think of the emotion and all that people were experiencing, and the number of people who wanted to go out and participate in these protest marches and try to show solidarity, with our Black friends and colleagues and so forth. So just, and probably a number of you, joined in on some of these protest marches. So kudos to you with the challenge of wanting to demonstrate and show that solidarity at the same time that we're dealing with a pandemic, and it's maybe with some trepidation that we, want to try to participate in something. So, and once again, who would have ever thought we had to think about questions like this? Can you breastfeed after you've been tear gassed? I mean, oh my gosh. So we've looked into that and have information on that on our website, but good grief. And then, of course, fast forward a bit to this fall as they've been searching for trying to find any evidence of the graves from the Tulsa race massacre. So I think it was probably I can't think of the right word to describe this either, but, just being able to finally find some evidence. And of course that's now, an actual grave site. So they've had to halt all of the searching as they try to determine, how to give a more respectful burial to those and be able to identify the ones that they've found so far. But so still a lot of work to do there. We'll be hearing a lot about that this year. So so another unprecedented event is the 3-day ice storm, literally 3 days of ice when the trees still had all their leaves. I mean, what a surreal feeling to, be working from home and hearing trees just come crashing down all day long for 3 days in a row. It did look like a war zone in our area. And then, of course, a lot of work to clean all that up. And this is the tree pile, the debris pile that was in front of our house. You could no longer see our house. You had to drive around this pile in the street to get to our driveway. And it was out there for 2 months. In fact, we were getting into decorating for Christmas, and we decided, you can't see our house, we can't put up our usual Christmas decorations, we'll just decorate the tree pile. So there's our 2020 and a Christmas tree. So thank you very much, 2020. Well, how many of you had a pandemic baby or had family members that had a pandemic baby? Or, of course, we had lots of pandemic babies, but we had our second grandbaby, and very different, of course, than the first one, where we were at the hospital, a lot of the time with baby number one. And the second one, we didn't see her until after they came home from the hospital. So, so this is baby Evie and big brother, and there she is at her 100 days celebration. So anyway, she's about 3 months old now. So that was definitely a positive thing in our family. Well, goodness, what else happened? We had the juxtaposition or the conjunction of Jupiter and Saturn. And we actually tried to get a picture of this with a spotting scope that we have. So this is actually Jupiter, that's Saturn up there. And there's actually a star in there, but that's 4 moons around Jupiter as well. So we were pretty tickled to try to get some kind of picture. We don't have a fancy, telescope or anything, but I mean, my goodness, to read about something that, it hadn't happened in 800 years. So it's like, okay, we're closing out 2020, what else is going to happen? So, well, welcome 2021. And as we all just came out of, the Antarctic, and we're so glad to see the sun and be able to get outside. Goodness gracious. But, things I didn't realize. I mean, I knew some of the lakes were freezing over, but we're out at Lake Hefner quite a bit and didn't realize, the impact on a lot of the migratory birds. So we did have a lot of the white pelicans, which I just love to see, the white pelicans and the cormorants and so forth that could not withstand the cold temperatures. So, and then of course, our neighbors to the south. This is an Instagram post from Kimberly Seals-Allers, who many of you will remember was our speaker last year before the world changed. And who would have thought that that you would possibly have enough snow in Texas to even consider boiling snow for your drinking water or to prepare infant formula for your baby. So, oh my goodness. But that's how unprecedented that storm was. So, but here you see, and that's, yeah, we've had more snow in this season than in the 31 years that we've lived here. So, and here's Lake Arcadia. Who would have thought it would be cold enough that you would see Lake Arcadia so frozen out here at Edmond. So, well, on a positive note, and kind of another unprecedented event is how fast we came out with vaccines to fight this deadly virus. So, so that's been just really exciting. I've had the opportunity to volunteer at 2 of the vaccine clinics, and I tell you what, it feels so good to be able to go and just really feel like you're doing something positive to stop this and to be able to help in some way with people getting vaccines. So that was a very, very rewarding experience to be able to participate in. And Oklahoma, we're doing actually pretty darn good. We were at least above the national average, and that we have 15% of our population that have had at least 1 dose of the vaccine. Of course, that's another lactation related question we had to answer. Is the vaccine safe for breastfeeding parents to receive? Yes, it is. So, and it's certainly much more much worse if the mother parent contracts COVID as opposed to any concern about the vaccine, but it's not going to cross into milk. It's not anything that's going to harm the baby. So absolutely that is recommended. So that's some definitely good news. And here we are in phase 2 with 65 and older adults with comorbidities and so forth. So trying to get as many people as quickly as possible. All right, so as we kind of move on and continue to, look at, what we're doing statewide for, breastfeeding support and clinical care and so forth in hospital practices. This is our Becoming Baby Friendly Summit. Well, I always kind of, like to start with America's health rankings. Well, that was kind of another unprecedented event in that they didn't do 2020 health rankings. I was kind of surprised to see that they reported some health data for each state, but they said because of the pandemic, they didn't think it was really fair or appropriate to do health rankings for 2020. So here you have last year's, and probably not significantly changed. And Oklahoma still, ranks kind of in the bottom 5 or 10 typically. So, and look at the states, around us. I mean, my goodness, Colorado. And I know we have some Kansans on here today. So goodness, what's Kansas doing that they're ranked so much higher? And this is looking at overall health outcomes, not, this doesn't particularly include breastfeeding. And then you can see I've circled Vermont up there as being number 1. So, some other data for us as we look at maternal mortality, and the CDC reported this last year, but just to kind of keep this, our colleagues in the Office of, or the Oklahoma Perinatal Quality Improvement Collaborative, of course, really focus on perinatal health and safety outcomes. And so maternal mortality is a very significant issue. And that we, in the United States, and as a developed country, we have one of the worst maternal mortality rates in the world. And our Oklahoma rate is 30.1. So we are, yes, significantly higher than the national average. And not every state had enough data for the CDC to give them a ranking, but there were about 3 other states that had a maternal mortality rate that was higher than ours. So, and if you think about that in kind of a different way to look at that is, if we lose 30 mothers a year, within 40 days of childbirth or loss of a pregnancy, then with our about 50,000, a little under 50,000 babies a year. This is 30 per 100,000, so that's about 50, excuse me, it's about 15 mothers a year. Let me rephrase that. And so that's about a mother, you know, a little less than once a month that we are losing a mother around childbirth. So that's way too high. And of course, we see huge disparities as well in that our Black mothers have you know, triple the mortality rate of others. So, and of course, since we're here to learn and, you know, support parents and babies with breastfeeding, we need to look at our infant mortality rate, because breastfeeding does impact that as well. And so this is our, you know, most current data from the state health department, and that our overall infant mortality is around 7 per 1,000 babies. So that's about a baby a day that we lose here in Oklahoma before they turn 1 year old. And once again, you can see the huge disparity, and that our Black babies are 3 times more likely to die in their first year of life than, say, a white baby. So, and some of the top causes of death in all of these racial and ethnic groups, you know, you're going to see disorders related to short gestation. So that's your, you know, preterm deliveries and congenital anomalies. So these are on, but, you know, maybe the order changes. And then we've got SIDS for white and Black babies that makes the top 3. And then over here for Asian Pacific Islanders and Hispanics, you know, we have babies that are affected by maternal complications. So, but if you think about, you know, what breastfeeding can impact on these, in these categories, breastfeeding definitely can impact the survival of preterm babies. And of course, we know it can really reduce the risk of SIDS as well. So definitely can see some change and some good impact on that. Well, how are we doing with our breastfeeding rates? As many of you know, the CDC comes out with their current rates every year in August. So these came out last August, and these are based on babies that were born 3 years ago. So babies that were born throughout the year 2017. And so the good news is, and, you know, the overall the rates continue to increase. Ever breastfed or breastfeeding initiation is, you know, averaging, you know, in the mid 80s. So we actually have a number of states that have breastfeeding initiation rates that are 90–95%. So definitely some huge huge increases there. Now, Oklahoma's rate dropped a bit. If we get more current data from the state health department, you know, we do break that 80% bar, but in trying to compare us to other states, you know, the CDC rankings are nice to have. And, you know, and this is reported every year, so the sample size is small enough that we can see some fluctuations from year to year. So if we probably reported, you know, like an aggregate 3 years, you wouldn't see, you know, some of these, you know, peaks and valleys that we seem to see, but they like to get this out every year regardless. But you can see any breastfeeding at 6 months, we're approaching 60% nationwide. So, I was excited the first year they reported it as breaking 50%. So that's great. But of course, look down at the bottom of the list, exclusive breastfeeding at 6 months. So there's our gap, you know, 84–85% that start out, only 25%, 24% here in Oklahoma that are exclusively breastfeeding at 6 months. So, so we definitely still need everybody that's attending the summit today to keep up the good work and keep plugging away to improve these numbers. So let's look at some of our partners. You'll be hearing some our little video news segments throughout the day. It's some things that we did to try to break, you know, just change things up since we're not there in person, and some of the networking that you would normally get to do, but trying to put faces to names and so forth. And so with our State Breastfeeding Coalition, COBA, last year was a very exciting year in that we hired Heidi Russell, our first ever executive director. And I mean, oh my goodness, what a leap of faith Heidi took to leave a nice, secure job and come join and take on the challenge of being COBA's first executive director. So, and she has just taken off like a rocket. So if you've kind of heard of COBA but never, really gotten involved, this is a really good time to get involved with COBA. We've got a lot of things going on, and I will let Heidi make some of those announcements when you see her on the little video news segment. But this is our current board of directors. You'll hear from JP, she goes by JP, and Cheryl today as well. So, all of our current board of directors. So our Oklahoma Mother's Milk Bank, you'll hear a bit about milk donation after perinatal loss when Cheryl Coleman speaks later today. But just to give you a little bit of data on how our milk bank is doing, in 2020, we dispensed over 127,000 ounces of safe pasteurized donor human milk, which brought us to a grand total of over 600,000 ounces since we've opened. So that's very exciting. We served 7 patients, and this at a time when there's no funding source for outpatients, so more on that in a bit. But we screened over 400 donor mothers, and we approved 183. So a little dip from last year. We actually were doing kind of better with donations early in the year, amazingly, and early in the pandemic. And then this fall, as things, were really the numbers, the positivity rate increasing, the hospitalization rate increasing, we started, having some drop in getting, donors and donations. But the good news is we've continued to increase, and we still had an increase in the milk that we were able to dispense last year from 2019. So in the middle of a pandemic, I think that's a pretty amazing feat. So kudos to our milk bank team, many of whom are attending the summit today as well. So, okay, so this is our Becoming Baby Friendly in Oklahoma Summit. So let's look a little bit at what's going on with Baby Friendly. There have been some changes in the guidelines that I want to make sure that we're updated on. But here's the current picture of Baby Friendly. We have over 1 million babies born each year in a Baby Friendly designated hospital. So that's about 28% of American US babies that are born in Baby Friendly hospitals, and just under 600. This number fluctuates a bit, and we saw a little bit of a dip in this, and definitely the pandemic has slowed things down because Baby Friendly assessors couldn't go to any hospitals, and they had to quickly pivot, just as we did, with trying to figure out how do you do a fair, objective assessment of a hospital and the hospital practices when you can't be there in person. So we've actually had some one of our hospitals that's in the designation phase, Duncan, went through kind of a first phase of a virtual assessment, and they're kind of still in process on that. So, so here's our current list, and so you can see where our Baby Friendly hospitals are. We'll be recognizing Comanche County here in a little bit when Joyce comes on, but and so you'll see this map again, so I'm going to move on because you'll see that when Joyce is presenting. But we do have 31.7% of Oklahoma babies that are born in a Baby Friendly hospital. What was the national average? Anybody remember? 28%. So yay, we're above the national average in something. We're above the national average in our vaccination rate too. So a couple of big positives there. Does Baby Friendly really make a difference? And we've had some questions on the PRAM survey, which goes out to mothers that have delivered here in Oklahoma whose babies are 8 weeks old to 2 years of age. And so they actually asked some, we got some questions added to the PRAM survey that were 7 of the 10 steps of the Baby Friendly hospital initiative. And these are the 7 steps that the mothers would know if they experienced it. The mother's not going to know if the hospital had a policy or how much training the staff have had and so forth, but they will know, you know, did they give me a phone number for help? Did they give me a gift pack with formula in it? Did they support, you know, breastfeeding on demand? Did they encourage me to, you know, exclusively breastfeed and so forth? And so you can see the kind of turquoise colored bars. If the mother answered yes, then they were, you can see, significantly more likely to be breastfeeding to 8 weeks or more. That's kind of the cutoff, you know, in the survey. And so the ones that I think that really stand out on this are if the mother was not given a gift pack with formula, then 74% of those mothers were breastfeeding at 8 weeks or more versus 56% if they were given one. So that definitely has an impact, and we've, you know, got plenty of studies to support that. That's a pretty easy step. So if you're anyone on today is working in a hospital that's still giving those gift packs out, talk to us. We can give you a lot of good rationale and make the case to your nursing leadership to at least eliminate that practice. And then the other one, I think, is if the baby was fed only breast milk. So the more babies they can send home exclusively breastfeeding, you know, 75 versus just under 50% that would still be breastfeeding at 8 weeks or more. Now, one that some people may notice, if the baby stayed in the same room, or kind of what we call the step 7, the rooming in step, that that was kind of a surprise that we didn't see much impact on that. And you know, I can theorize a number of reasons for that, you know, depending on the hospital and if the baby's in the room, is anybody actually, did the staff have adequate training? Are they able to actually help the mother? If the baby's in the room but the mother doesn't know what to do and no one's helping her, then, and this is pre-COVID, of course, too. So, so definitely some questions that one raises, and more data could be gathered on that. But this tells us that definitely by far, if these steps are in place, the mothers are significantly more likely to be breastfeeding to 8 weeks or more. So now let's look kind of at another measure of how we're doing, and that's in pink, the CDC's maternity practices and in infant nutrition and care survey that they send out every 2 years. So the 2020 survey has been in the field now for, it was delayed and getting launched last year, of course, as everything was due to COVID. And so it's still ongoing, but today is absolutely the last day. So they've been struggling, and they usually try to get, you know, 80% or more hospitals to participate. And Oklahoma wasn't too far behind. We were at 68%. And this was about 10 days ago. So so maybe, you know, hopefully we usually have really good participation with our hospitals. So we'll see how the final numbers come out. But this is what the state report looks like that we get. And each hospital gets their own individual benchmark report, and they can see how they compare to other hospitals of similar size or other hospitals in their state. But, you know, out of a total score of 100 points, the national average is 79, and our average was 75. Now, 2018 was a year they had made some changes in the survey, so we can't really now compare this to previous years. So it's kind of starting over with this, but I'm going to point out a few on a different slide here. So these are some opportunities for improvement. In how many hospitals were routine procedures, you know, like heel sticks, newborn exams, and so forth done in the mother's room, and only 33% said yes to that. How many newborns, you know, the question was, do few newborns receive infant formula, and only 33% answered yes to that. So a lot of formula supplementation going on, a lot of babies being taken out of the room. And that may reflect on the rooming in results on the previous from the PRAM survey, and that they say the baby's in the room, but they're still taking the baby out of the room for a lot of procedures. So that could certainly be another impact on that. And how many, hospitals or mothers really taught position and latch to hand express and so forth, just under 50% of the time are they supported with that. And 44% of hospitals do not give mothers the free formula gift samples and so forth. So we still have a lot of hospitals that say they're doing that. And then, of course, a lot of hospitals are still getting the free infant formula. And sadly, this was definitely a surprise to me, did their breastfeeding or infant feeding policy have really all of the evidence-based practices or policy elements, and only 18% of the time. Now that's a pretty easy one. We've got a model policy from COBA. Certainly our Breastfeeding Resource Center can help any hospital that needs to update their policy. But it's not just the policy, as y'all know, we have to train the staff to implement the policy. That's a key piece of baby friendly. So more on that here in just a minute as well. So briefly, as I said, there were some revisions to the baby friendly guidelines from the World Health Organization. And as our Baby Friendly USA has been, studying and evaluating and kind of changes to make to that. So it's basically steps 7 and 9. So 7 is the rooming in, 9 is the pacifier piece. So 7 really, baby friendly has always been about patient safety. Don't implement any step if it's not, safe for the mother and the baby. Don't leave an exhausted mother with a baby where she might, drop the baby or something, and that's not a safe environment. But they tried to clarify this better in the guidelines. So certainly, if there's a medical reason for a separation or a longer separation, a safety related reason, or of course there's always been a maternal request if it's an informed decision on the part of the mother. So it's all about documenting, and that we've educated the families about the impact of that as well, but definitely assessing for safety. And then step 9, I think because the World Health Organization, at least the evidence that they looked at, this has been a controversial one all around from all different angles, but at least they say now to just focus on counseling mothers on the use of pacifiers, that we recommend delaying introducing pacifiers. It can make breastfeeding harder. It can mask those feeding cues. Babies may not feed as frequently at breast and so forth, but rather than completely prohibiting them, making sure that we're educating families about that. So that's a couple of key changes. And then, the other big piece and challenge with Baby Friendly is staff training. And so we've been working, and of course through the pandemic, to offer more options. So definitely check out our website for different trainings that are available, but some that I want to highlight. We do have the 15-hour online course, thanks to Jacqueline for a lot of hard work on this to really update, upgrade. It's a new platform. So hospitals that are currently formally enrolled to work on Baby Friendly and in our state project will actually get a 50% discount on the cost of this course. But it does meet all of the Baby Friendly requirements. With all the canceling of breastfeeding support groups and prenatal breastfeeding classes and things like that, we hurriedly put together, and not to say that it's not good quality, but this was the first thing we tried to do last year, was really get a virtual prenatal session. So this is free and available to anyone. Parents can do this on a smartphone, on an iPad, or what have you, and it is in Spanish as well. So in the Spanish one is 100% in Spanish, including all of the videos. So it's very interactive, engaging, and so forth. And Jacqueline is hard at work on a provider training. This is something that's been on our list for a long time. So we hope to actually have some official launch of this in the next couple of months. So stay tuned on that. And just know that we do have a lot of handouts on our website. So certainly those of you that are maybe in more rural areas and don't have as much access to resources and so forth, always check out our website. These are easy to print out, or we can always mail you some, nice copies as well. So last but not least, and most exciting, with thanks to COBA's executive director helping kind of make some good connections, we've had 4 breastfeeding bills proposed this legislative session. So 2 that are still active and have some strong possibility of getting passed. Senate Bill 121 is lactating school employees getting time for milk expression. So that includes teachers. They've been left out of all of the other break time legislation. And then Senate Bill 469 is for Medicaid to cover pasteurized donor human milk for babies in the home, because that's a big gap in our state, and that's actually getting heard Monday in appropriations. So think happy thoughts. If you can look up your senator, if your senator happens to be on the appropriations committee, certainly give them a quick call or an email and tell them how important this bill is. 2 others that did not get heard, but we may come back again, of course, next year. And then lastly is a Senate resolution to start looking at incarcerated mothers and how can we accommodate breastfeeding and milk expression for those mothers. So kind of starting the groundwork and raising the awareness of that as an issue. So I was going to do a poll question, but I think in the interest of time, but y'all can certainly type in the chat box if you have one of these that you would love to see passed first, and definitely kind of give us that feedback. And while only 2 are still in play, we will certainly be looking at coming back next year on that. So as I wrap up, then I just want to kind of tell you that every year we do this, and we want to focus on supporting our baby-friendly efforts in our hospitals and so forth. And yet we don't every year just want to say, well, here's how you do step 3, and here's how you do, step 6. But all of the information, all the presentations today relate to the 10 steps. And ultimately, what we also want to highlight is, baby friendly, the healthcare environment should not be restrictive or punitive. We want to see informed decision making on the part of the family, and we need to be sensitive to cultural and social diversity. So we've really tried to address that today as well. So